All right, guys, so now we're doing pretty much, we call it leg posture, but it's pretty much just trying to get all the tissue of the lower body to actually move the way it's supposed to. If you're sitting all day, hip flexors get super stiff, hamstrings get tight, calves, ankles, like everything just gets super stiff because guess what? You're not really moving too much and it stiffens right on up. This is the help with that. So what do you need? Foam roller, a little ball, lacrosse ball, whatever you need, spiky ball, anything that will kind of dig into that tissue. So like our normal concept goes, MSA.
Myofascial release. What we're doing first is we're sitting on the foam roller, hitting that glute piriformis area, roll up and down. Remember you got your 10-20% rule. If you want, you can go slow, stop on that knot, kind of dig, do the pin and stretch type technique. Whatever your poison is, go ahead and get that tissue to open up. Of course, you would do your other side, but we're going to keep on tackling the legs. So now we're going to do your IT band, quad, that lateral quad area, TFL. So Doc starts at the top of the hip here, and he's working this little chunk of muscle right through there. It's called your tensor fasciatus, blends into the IT band, okay? Then you can kind of hit that IT band lateral quad area, so that's from like the hip all the way down to the knee. There again, you have your passes. Then he's going to slowly transition to the front part. Now this is kind of review, so this is your quad. And again, you can bring tension to it while he's bringing his heel to his butt. You can, there again, you can go slow, you can stop on it, hold that tension. You can even have someone hold down on it while they flex and extend. You can be mean to people, it's okay. You're helping them. Then of course, don't forget the inside part of the knee. So you hit outside, quad, now you're hitting the groin. Don't forget this one. Typically everyone seems to forget this one. So this is one that'll actually get tight and it'll actually have weird movement patterns when you're doing squats because it'll kind of make that knee go in. You never tackle that bad boy and do what it's supposed to do, causes dysfunction. Okay, can't forget the back part of the leg, hamstring. So we pretty much hit here, side, front, inside, back part. You just hit the whole can for the most part of the leg. Okay, now we're just going to continue to go down the body. You hit the whole thigh, go ahead and hit those calves. It's already here. Now, we've already kind of showed you this part with the calves, but what about the bottom part of the foot? And what about this front part of the foot? Now, we're going to use just the foam roller. We'll use the foam roller right now to do the anterior tip.
They might not even have it. You can do it with your hands, just like this, where you're just holding that pressure into it, or you can even lay on it where your body is kind of like here, and then you just shift your body weight over and then just roll on that front part of that shit, okay? Now, that's okay. If you gotta use what you gotta use, that's all right. But I would rather use a ball. So you can just sit there. You have your shin bone, which you'll be able to feel it. It's hard. Go on the outside part. That's called your anterior tibialis muscle. This muscle is pretty darn important for foot and arch function, okay? Now, say someone's ankles are super locked up. Either whenever you're doing your calf stretch, we'll eventually get to, you should feel the stretch in the back part, okay? Sometimes if it's locked up in the front, it's more of a joint problem. As doctors, we work on mobilizing that joint. That kind of lets us know what's going on. But a lot of times when you have this ankle joint locked, the anterior tib will work hard to try to force it to come back even though it's jammed up, okay? So you'll have a lot of dysfunction here. First, you need to mobilize this bad boy, then we'll fix this. Okay, plantar fascia. Doc likes using this fun spiky ball. What you're gonna do is, like anything else, you're just holding pressure applied to it and rolling, okay? You can just go side to side. You can go heel to toes. You can get a smaller ball, and then you can sit there and kind of let your big toe and your pinky toe like wrap around that bad boy to try to improve the little arch that's right here by the toes. You're just trying to help improve the function of the foot, okay? You can even put the toe on the ground, kind of go a little bit forward, and then just sit there and go your side to side position where you're sitting there grinding out that plantar fascia from the foot all the way to the heel. Okay, now this is just a good way to mobilize that tissue. If your plantar fascia is inflamed and it's not, it's kind of angry, pissed off a little bit, get a frozen Gatorade bottle. Those little ridges and notches are in there. First off, you're helping the inflammation because it's ice, but then you're doing the same concept here. And sometimes whenever you're rolling on that foot, it hurts. So guess what? Cold helps numb up that area so you can still tackle and do the things you need to and not hurt as much. Okay, so this one is traditionally called the couch stretch. I think it was turned by Kelly Starrett, I believe. You just need something. This is just a plyometrics box. You can use a couch, chair, whatever you need, a bench. Put your foot here. Now, just put it on the ground comfortably for right now. As you get better, this knee is gonna get closer and closer to whatever the wall, platform, bench you're at. But the bad thing is, a lot of people will cheat and their back will arch a little bit and it'll do weird compensation problems. So let's start easy and progressively work harder. Now, you're here, so this is a psoas stretch, a hip flexor stretch. You have to look at where it inserts and the origin of the muscle. So it inserts right around here in the front part of the hip, but it's also part of the front part of the lumbar spine. So we're working on hip extension, one part of the move, but the secondary job of the psoas is lumbar spine extension. So it's going to want to arch the back whenever it starts getting stretched. What your two jobs are is to try to do hip extension, but then also kind of keep your core engaged so you do not move the lumbar spine. Because what will happen is you'll get nice and pretty and beautiful movement, but then you'll arch the back and you'll have no pressure or tension on the actual psoas muscle, the thing we're trying to stretch. All that to be said, start nice and tall, core engaged, then squeeze your glute, whatever leg is up here on the bench, and kind of lean forward. Good. Now, we always like to do the fun pails and rails style. So now that he's here, he's going to pretend like he's doing a leg extension. So he's pushing his foot really hard into this bench, about 6 seconds, and then relax. See if he can sink deeper into that movement. I always try to reposition myself every time. Core engaged, glute tight, nice and tall. Push again. Relax. If you have tight quads, you will 100% feel this issue, okay? But that's okay. Do this a few times, reset, breathe, okay? Okay, so we worked on the quad, hip flexor area with the couch stretch. Now we're gonna get the inside part of the leg, the groin. All right, so what we like to do is getting on one knee down. You're just kind of a nice, stable position. Go ahead and stick this leg all the way out, and you should feel a nice big tension right here from the knee to the pelvis. Now he was kind of more in more of an upright position, but then I want you to actually set your hips back toward your feet, and it'll bring a different type of tension when you sit back, okay? Then you can also try to bring the foot out. You can internally and externally rotate at the hip itself, the leg, just to feel different type of angles and positions that sometimes you don't really hit if you're very robotic with your movement. I have to be in this position. I like to kind of sit there and move that hip back and forth to feel where that ball and socket joint is freely moving, okay? Now, pails and rail style. Once you're here, you can drive that leg into the ground. You can push the ground away. Then you're gonna relax, sit back deeper, and breathe. Okay guys, so we worked on hip flexors, then we worked on the groin. Now we're working on the back part, hamstring. This one might be a little bit different for you. So typically you want to have a platform to kind of put your foot up on. You can do a chair, your desk at work, you can do whatever, it'll be an interesting conversation. What I want you to start off by doing is your pelvis should be nice and square. What your tendency will want to do is like I put this leg up, I want to take that tension off and kind of bring my pelvis this way. Pelvis is going to be the main function of this one, or focus. So he's going to put his foot here, pelvis is nice and stable, he's going to bring his foot up. You should sometimes, that's all you need, okay? That's okay. You can even internally rotate that leg back and forth. Typically, it'll kick out this way to bring tension off. So we want to kind of bring the toes here if you can. Now, this is a good starting point. Sometimes that's all you need. But I want him to think of this hand and his pelvis rotating toward the knee that's bent. And sometimes that's all you got to do. Take a nice deep breath, relax, good. If you want, and you're like, man, my hamstrings, I got phenomenal range of motion, what you do is keep your back arched just a slight, and then I want you to bring your chest and belly button to this knee, if you can. Might be all you need. Try not to round the back, keep it nice and engaged, bring the toe up. Now that you're here, sometimes that's all you got. It's fine. But if you want to add a little caveat to it, pails and rail style, drive that hamstring, drive that leg into the bench table, whatever, 6 seconds, relax, see if you can hinge that hip a little bit further. Nice deep breath, reposition yourself, good. So this one is a difference maker when it comes to hamstring because you're not really bending the spine, you're changing the angle of the pelvis where the hamstring is attaching to. All right guys, so if you made it by now, you're pretty good. But the good thing is, this one's a nice and easy one. Probably you're more apt to do this one or remember this one if you played sports. But what are you gonna do? You're just gonna find a wall, put your toes up on the wall. This one, he's just gonna keep his knees straight. And he's gonna try to bring his hip to the wall, okay? So everything is nice and straight. He is hitting all of this fun musculature here. Now there again, you can do your pails and rails. He can try to push his toes and his foot into this bottom part of the baseboard and then relax. See if you can go a little bit further. Own that position. Nice deep breath. Good. Try a little bit more. Push into that ground. Good. Now, this is one area, the gastroc. Now we're going to get that deeper one. He's going to bend the knee a little bit. And then same thing. See if you can push that toes into the ground, into the wall. Relax. And see if you can try to bring that knee closer. So it's not hitting this area. See how it's kind of not to tension like it was before. It's hitting the deeper one in there called your sulcus, okay? So try this one out. This is a good micro break, which we'll work on in the future, but get this bad boy moving because a lot of times your foot and ankles don't do what they're supposed to do.